on management of equine metabolic syndrome and other topics. Our presenter today is Dr. Stephanie Valberg, Professor and Director of the University of Minnesota Equine Center in St. Paul, Minnesota. She received her undergraduate degree and DVM from the Ontario Veterinary College, completed a PhD in equine exercise physiology at the Swedish University of Animal Science, as well as a residency in internal medicine at the University of California, Davis. She is a board-certified internal medicine clinician at the University of Minnesota, and her research centers on neuromuscular diseases in horses with a specific focus on genetic diseases of skeletal muscle and their nutritional management. Dr. Valberg has received several research awards and is a frequent speaker at national and international veterinary nutrition and genetic conferences. And please note that you will be able to ask questions using the text chat at toward the left of your screen. We will try to hold most of the questions and answer them at the end. And we are also recording this presentation today, and we will upload it to our website by the end of the week. And at this time, I will go ahead and turn the presentation over.
Thank you very much, and thank you everybody for joining us. I'm going to talk primarily today about shivers, which is a very interesting but complex and little understood neuromuscular disorder in horses. The topics that I'm going to cover are: what is shivers? How do we diagnose shivers? The one that most owners are worried about is, does this disorder progress? Are there any treatments for shivers? Why do they get it? And then what can we do to understand more about shivers, since this is not a very well understood disease? I want to start by acknowledging all of the horse owners that have sent us information about their horses with shivers, either through their veterinarians or by answering an online survey, which I'm going to direct you to towards the end of the presentation, and also all of the veterinarians that have contacted us. Since there is so little known about this disease, we've really learned an enormous amount from the information that's been sent to us and the videos that we've received from horse owners. Also want to acknowledge my colleague, Dr. John Baird at the Ontario Veterinary College, who's done a lot of work together with us on this disorder and provided a lot of the information and background for this presentation. And a senior veterinary student at the University of Minnesota, Alex Bianca, who's worked and put a lot of work into our Shivers website, and the staff of our university who have helped us evaluate a number of patients with shivers. The classic definition of shivers comes from the fact that these animals quiver, thus the word shiver, and it often pertains to a specific movement disorder of the hind limbs, in which, particularly when asked to back up or to pick up a foot, the horse will lift its leg, flex all of the joints in the hind limb, hold the leg a little bit out to the side frequently, and then hesitate with that in a spasm before they're able to put the foot smoothly back down to the ground. You can see here other pictures from other aspects of a horse that has shivers, and you can see that there is a great degree of flexion both in the hip and in the hock and in the fetlock in this horse, and sometimes the other limb is held out kind of in extension while the one limb is held in flexion. And this can affect both hind limbs equally, or it can affect one hind limb worse than the other. Well, many veterinarians today that work with light breeds of horses are not very familiar with the condition shivers. In its heyday, when horses were the primary mode of transportation and primary means of working around the farms, shivers was described in textbooks as being as common as dirt. And one of the reasons for the fact that it used to be very common is because it has a high prevalence in draft horses. And in fact, in a survey that we did with Dr. Baird and Dr. Anna Furshman, we found that in examining 113 Belgian draft horses, that 18% of the Belgian draft horses had shivers. So in some draft breeds, it's very common, and therefore it was a condition that veterinarians were very familiar with in the 1800s and the early 1900s. But as heavier horses have become less common, we have seen less of this disorder, and there is a lot less of it written about in veterinary textbooks. The breeds that are most commonly affected by shivers, as mentioned, many draft breeds, especially tall draft horses. Warm bloods are affected by this disorder, and draft and warm blood crossbreds. And also light breeds of horses can be affected, although the incidence isn't as high in these breeds, but light harness horses, hunters, jumpers, and thoroughbreds and quarter horses are described with this disorder. When we looked through our database of muscle biopsies that have been sent to the University of Minnesota Neuromuscular Diagnostic Lab, we identified 142 horses with shivers, and the majority of these were warm bloods, 57 of them, followed by quarter horses, draft horses, thoroughbreds, and then crosses. This is probably also reflecting the degree of concern and desire to work these horses up to the maximum extent, in addition to the breeds that are affected by shivers. It can start at any age, really, over the age of 1, and it's difficult to know exactly when this disease begins because the signs are quite insidious and very subtle at its onset. So on average, we found that horses are about 6 years of age when they're diagnosed with shivers, although in really severe cases, we've seen it diagnosed as early as 1 year of age, and in some cases, the owners haven't noticed it until the horses are 18 years of age, although we're not sure in those cases how long the owners have necessarily had the horse and whether signs were present with a previous owner. What's very interesting when we look at our data is that there are many more geldings that have been reported to be affected with shivers than mares. If we look at our average warm blood database, we tend to see about twice as many geldings as mares receiving muscle biopsies for warm blood horses. But when we look at our shivers horses, there's this very, very high predominance of geldings, and that's something that bears more looking into. The clinical signs can be highly variable. They can be very mild in some horses and very severe in other horses. But most of the time, the first signs of shivers are often noticed by the farrier. And that's because they'll develop muscle spasms and cramping when the legs are picked up. And when the farrier is trying to work on the feet, the horse will keep snatching the foot away and make it very difficult to get the foot trimmed. And also because they have increased sensitivity when the foot gets hammered, and that also causes them to pull the foot away. So owners also may notice this condition when they're trying to pick up their feet, that the horse has difficulty picking up the hind limbs for picking up the feet, and you may notice that the tail starts to get elevated and tremble as this is happening as well. And as I'll talk about a little bit more, the disease usually affects the hind limbs, but there is a form of this that can affect the front end of the horse, and in those cases, usually the hind end is normal. And the signs of shivers can come and go a little bit. They can be worse on some days, better on other days, and it can be a little bit difficult to figure out what it is that's exacerbating a horse to have this shivers-like gait. The things that we have noticed that tend to make it worse is a change in the footing. Some horses, when they're stepping out of the stall and onto concrete, have difficulty. Some horses, if they see a slippery surface, show more evidence of shivers-like activity. Certainly standing still tends to make the signs worse. So horses that have been box stall rested, or if they're kept in stocks or they're kept in tie stalls for a period of time, usually as they come out of that standing still, they'll look much worse than if they've warmed up for a while. And there's a very strong correlation to the severity of the signs a horse shows from time to time and the amount of stress or excitement they're experiencing. So if they're harnessed and waiting in harness to move, or they're at a show where they tend to be stressed by circumstances, you'll see conditions worsening. And in some cases, horses reaching down to the ground, for example, trying to drink water from a pail on the ground, may show exacerbated signs of stiffness and in their back end. And then, as we'll talk about too through this presentation, shivers is a separate disorder from polysaccharide storage myopathy, but they can occur together, and sometimes the signs become more severe if they have another muscle disease. So in this video, we're going to show you the classic signs of shivers in horses, and they are moderate signs. You'll notice that as the horse walks forward, it's going to be normal, and the signs are going to be worse as the horse backs up. You'll notice that this horse is well muscled. He's got nice muscle mass along his back end. You'll notice that his hindquarters are well muscled. He's got a fluid gait. His tail is held normally. He doesn't have an abnormal tilt to his pelvis. He turns normally, even though it's quite a tight turn. And he's not showing any signs of stress at all. When he stops and is asked to back up, he'll elevate his head. He drops his quarters a bit, and particularly on his left hind, you'll see an exaggerated flexion before he places the limb on the ground. So these are just early signs of shivers, which oftentimes don't impede the animal's activities. It's able to jump and perform under saddle quite satisfactorily with just these modest signs that occur primarily when the horse is backing up. So the classic signs of shivers can also occur not just when the horse is backing up, but when the horse is pushed over. You can see in this video here the signs that are being seen as we're pushing this horse over to try to get him to walk through this gait area. They can occur when a horse turns quite sharply, and also will be seen when picking up the hind limbs. So in the early stages of this disease, usually the forward gait is normal, but the disorder is seen in tight turns or when the animal is asked to back. And as mentioned, one of the early signs that we see is problems holding up the hind limb. And in this case, you'll see in this video that the horse is offering its hind limb willingly, and that's not a problem. But as the hind limb is picked up, it's held in a flexed position. There's no effort that needs to be made by the handler to keep the legs flexed. And there's a spasm that's occurring in the hip and in the hock and in the stifle that's holding that leg in a spasmed position. More severe signs, or if the disease progresses, you'll see that more and more frequently the horse will hold the limb in an elevated position before placing it on the ground after hesitation. That the limb will start to shiver and quiver, and many times the tail will be elevated and quivering at the same time. You may see that not just when the limb is held up, but other muscles not involved in flexing that limb will start to shiver and quiver, and they may even be moving when the animal's standing with fully weight bearing on that limb, and that these signs will reoccur more and more frequently as the animal is asked to back up or move tightly in a turn. This next video is going to show you a draft horse with signs of mild shivers, and again, in this horse you'll notice that it's quite normal walking forward, the tail's in a normal position, but when asked to back up, the tail elevates and trembles, and you see excessive flexion and a bit of hesitation before the limb is put down. And notice too that the head is elevated quite high in order to be able to back up. The more it's asked to back up, more tension it gets in its hind legs, and the harder that can be back up. But in this case, it shows quite nicely the tail elevation and the tail trembling. So if the disease remains like that, it tends not to be a problem. But if the disease tends to progress, as you'll see in the next video, where the degree of flexion is much greater and where the animal has problems in turns and backing up, then it starts to impair the animal's performance and comfort level. You can see excessive flexion of the left hind leg as you watch the animal turn at the end of the corridor. Here. And again. Then as he starts to move forward, the movement tends to be more normal. When he's asked to back up, he'll have involvement of both the left hind and the right hind, with exaggerated flexion and holding the leg out to the side.
He's worse bilaterally now.
Great deal of difficulty backing, and sometimes it causes the other leg to extend while one is flexed. And then also I'm going to show you the degree of elevation of the tail that you can sometimes see with backing, and how that can be held up and may tremble as well.
Does he still let you pick up his...
Really, you can't imagine how distressing it is for the horse not to be able to do that in a normal fashion. I don't think it's painful, but I think it's distressing that they're not able to move the way that they feel they want to. As the disease progresses, this shows you in a more advanced signs of shivers in a video courtesy of Dr. Baird. And you can see that this horse has lost some muscle mass. It's got some atrophy. And you'll see a lot more quivering in this particular case. The animal shakes and trembles. It's got trembling in its quadriceps muscle area. It has a much more base-wide stance than normal, holds the tail off to the side. The tail trembles as well. And a lot more stiffness and spasticity in its gait, and a lot more quivering that we often will see this in more advanced stages. And that's why it's called shivers, because of that muscle trembling that occurs as it advances. So once the disease becomes quite severe, one of the things that becomes quite debilitating with these horses is the fact that the spasticity is so severe it starts to affect them as they walk forward, and also that they will hesitate before they put foot down, but then they will start to slap the foot down so that it's really being put down very hard. And in this video, you're going to see putting the horse onto the scale, and in this case, we're changing the footing, which really makes the disease more severe. And you'll see that the horse places its limb down very hard and is also affected just in making sharp turns. So you can see excessive flexion in that left hind as he's looking at the change in flooring and kind of contemplating walking forward. It becomes severe and shakes and trembles even in forward motion. He has a lot more difficulty when he's stressed now, trying to get that limb down onto the ground. And he'll slap it down hard here. And that can be part of more progressive forms of shivers. And in this stage, it's really quite a debilitating disorder for the horse. The other thing that becomes an increasing problem with advanced shivers is the horse's inability to pick up its hind legs. It makes it very difficult to trim the horses, and it also makes it very difficult to care for them on a day-to-day basis. And there seems to be a sense that the horses develop of discomfort or anxiety that's going to occur when you pick up their hind legs. So it seems to be a sensation that they have even before you pick up the limb, that they're anticipating that they're not going to be able to do this properly. And you'll see this in the following video. The mare cooperates very nicely with the forelimbs being picked up. This isn't a behavioral issue at all. She has no trouble doing that. You see she stands a little camped out behind with her hind limbs out behind her. And now that she knows that I'm going to ask her for her hind foot, she starts to develop evidence of distress. She can't flex it and give that foot to me. She has to stomp it down. And sometimes they'll pick up the other hind leg rather than the one that you're asking for. And they really are not being naughty. They're just not able to function anymore properly and give you that hind leg. So in advanced cases, you see these signs of being unable to back up. They're just not capable of doing that. They'll frequently raise the shivering hind limb and hold it up there. They may stand stretched out, kind of in rigid extension with on their toes and the hind limbs. And in some horses, one of the things that we see is they'll actually stretch out their forelimbs, sometimes almost even cross them and hold them out in front of them. And as it progresses, it's more difficult for them to coordinate getting up and getting down. So they're often hesitant to lie down when they're in their stall, and their muscles will start to waste. One of the rare signs that we see is involvement of the forelimbs, the neck, and the face. And in these cases, horses are normal walking forward. They're normal backing up. You can pick up their hind limbs without any difficulty. But perplexingly, this involves the forelimbs. And either when you try to pick up the front leg, they're not able to bend at the knee, and so they hold the leg out in front of them. Or if they are able to bend at the knee, they'll have tremoring in their triceps muscle above their elbow. And they'll have a very stereotypical placement of their neck and head, meaning they'll always do exactly the same abnormal pattern with their head and neck, and a lot of times they may blink or they'll have chewing motions or smiling motions with their lips, and you'll see that in the following slide that has a video of this. You'll notice that the horse is reluctant to pick up the right front and holds it out in front, and it has to almost have a clasp knife push to get the flexion to occur, and then the head comes up and goes off to the right, and the lips are quivering as the horse is holding its head off to the right. And again, this horse is perfectly normal behind, perfectly normal backing up and walking forward. And for some reason, this form of shivers is affecting the front half of the horse rather than the common form that affects the back end. And you'll see as she picks up the left front, we have exactly the same pattern of movement of the head and of the lips in this particular case. So while it's most commonly affecting the hind limbs, shivers can affect the front limbs of horses as well. So the biggest problem I have in answering the question, will it progress, is we just don't know. In some cases, shivers will progress, and in some cases, it will progress quite rapidly. In other cases, the signs that you see with just having a little bit of difficulty backing up and holding up the limbs stay static for a long period of time. So whether or not progression is going to occur or not is very, very difficult to predict. And that's particularly problematic for veterinarians when we do pre-purchase examinations, because there's some highly successful dressage horses and jumpers that have early signs of shivers, and it's really difficult to tell whether or not, that's going to be a problem for the horse, or that's just a minor abnormality in their movement that's going to be just a consistent finding, but potentially not progress. One of the problems that we see in animals that do have progressions is that they can't get up and down to sleep, so they tend to sleep standing up, and then they will be so excessively tired they'll almost fall over, and you can see that they'll have bruising and a scarring on the front of their fetlocks from these sort of half falls that they take before they catch themselves and wake up. Some of them may have a particular stance and show excessive signs of sweating. We looked back into the textbooks with the work that Dr. Baird has done to try to see what do the old textbooks say about whether or not shivers progresses. And in the textbooks from the early 1900s, they say that in most cases it is a slowly progressive and debilitating disease, that horses may work well for many, many years, but the tendency is for the severity and frequency of the muscle spasms to increase. And in particularly when they talk about horses that are asked to jump, like hunters and jumpers, they feel that over time the horse may lose power behind. They're still willing to jump, but they may not be able to clear the obstacles that they used to be able to clear. And in the animals where forelimbs are involved, the textbooks report that the animal's work capacity is unaffected, but as that severity of the spasms increase in their front legs, they become progressively more and more difficult to work with. So far, we've been delighted to have 51 people contribute to our online survey who have owned horses with shivers. So the only thing I'll say so far about this survey is we haven't had all of these horses confirmed by a veterinarian to have shivers. So some of them may have other conditions, but in large part, reading through the surveys, they look like they very well do have shivers. And many of the owners have not had the horses for a long period of time. We will follow up with them in order to look at progression of horses. But the answers so far, when we asked owners if signs have progressed, about 50% of the horses have shown progression of shivers so far in the survey work that we've done, and the other 50% have stayed about the same or potentially gotten slightly better. So the best information we have right now is that about half of the horses seem to develop progression of clinical signs. We had a wonderful opportunity of an owner who donated a horse with shivers to us to be able to follow the progression of the disease along. I showed you the first video earlier, and I'll show it to you again. And then I'm going to show you this horse a couple of years later. So in the first video, the horse is able to walk normally. forward. And I want you to notice as he turns that he turns perfectly normally as he gets to the end of the barn. So forward motion is unaffected in the first evaluation we did of this horse. And when he backs up, you'll see that he has some difficulty backing up, but he's very willing to back up. And his left hind is slightly worse with shivers than his right. But he's very cooperative in trying to move backwards. This condition did progress in this horse, and he was donated to the University of Minnesota. And I'm going to show you the second evaluation in trying to get the horse to back up in the next video. You'll notice that as I turn him, his left hind will lift, so he's showing the shivers-like gait as he lifts and turns. This is the same horse that we walked onto the scale. His muscle mass has decreased, and he will back up a couple of steps with the shivers-like gait that's worse than it was before, and then he can't quite figure out how to make it happen anymore. So I am actually pushing as hard as I can from the front of this horse, asking him to back, and after a couple of steps, he just can no longer coordinate the effort to back up appropriately, and will develop that pretty severe shivers-like stance with his left hind. As well as on turning, he'll show the shivers gait. And I'm pushing as hard as I can, and he just can't manage to do it. So this is a point where the horses really become quite debilitated and difficult to have around when they get to the point where they're constantly having this type of disorder. Okay, we can move on to the next slide. So how can I be sure that my horse has shivers? As I mentioned before, it's very difficult in the early stages to tell. But really, it's a veterinary diagnosis, and it's a diagnosis of exclusion, meaning we look for all other causes of a horse to have an abnormal gait and make sure that those causes aren't present. So we do a full physical examination, have a very close look at the muscle mass and the symmetry of the horse. We do a careful lameness evaluation, as you can see Dr. Ernst at the University of Minnesota doing here with a flexion test. So we're evaluating the hocks, the stifles, the fetlocks, flexing them, having the horse walk and trot off, ensuring that the problem we're seeing is not due to pain in the limb from a lameness rather than from a neurologic abnormality. And we also do a full series of neurologic examinations in which we walk the horse forward in serpentines, in tight circles, in larger circles, to the left, to the right, look at neck flexion, evaluate all the cranial nerves to ensure that there aren't other signs of neurologic disease present in the horse and that we contribute this to another disease. And we're particularly looking to ensure that the horse has or does not have signs of incoordination or ataxia, meaning does he know where his limbs are in space? Horses with shivers don't have control, but they appear to know very well where their limbs are, and they're not incoordinated, they don't step on themselves, they don't stand in abnormal postures because they don't know where their limb is. And so that's part of establishing that the horse doesn't have another type of neurologic condition, but more likely has this gait disturbance associated with shivers. What else could it be? Well, many times we have seen horses that have a stance similar to the one that's shown in the picture here, where the only sign they really show is that they hold their limb up and do that frequently, pick it up and down. And they can actually just have pain in their foot. They can have a hoof abscess. They can have arthritis. And we found horses with old fractures in their fetlock joints with tendon issues. And so it feels abnormal. And so they lift the limb and they hold the limb up. But the disease is not actually shivers. So that's why it's important to do a full neurologic exam. There's always the consideration too, which is particularly difficult in the early signs of shivers with horses that just don't like to pick up their hind feet. And so there has to be some horsemanship involved in assessing whether or not this is a behavioral issue, whether the horse can do it under some circumstances or for some people, and is just incapable of doing it if it's shivers, or if it's a behavioral issue and it's capable of doing it under some circumstances with some experienced help. The other disorder we like to rule out is a deficiency of vitamin E, and that can be picked up oftentimes on a blood test to measure vitamin E. Horses with vitamin E deficiencies can show abnormal gaits. They can do some of the shaking and tremoring and shivering. They can abnormally flex their limbs as they move forward. And eventually, over time, they also lose muscle mass and atrophy. So that's one of the differential diagnoses that we need to make. And the other thing we like to evaluate the horses for, too, is polysaccharide storage myopathy, a muscle disorder in which they store excessive amounts of glycogen in their muscle. There are two forms of polysaccharide storage myopathy. One form, which we've discovered at the University of Minnesota, is due to an inherited disorder of a muscle enzyme called glycogen synthase 1. And that glycogen synthase enzyme has excessive function. They store too much sugar in their muscle, and we can test for that now as a genetic disorder using hair testing. It's the most common form of polysaccharide storage myopathy in the Belgian and Percheron draft breeds, but it's not the most common form of polysaccharide storage myopathy in warm bloods. So in warm blood horses, we don't have a genetic test for the most common form of polysaccharide storage myopathy, and therefore we have to look at the muscle to see whether they have polysaccharide storage myopathy. And the muscle veterinarians in the field most frequently biopsy to determine this is the semimembranosus muscle. It's labeled SM, and you can see this horse has had a biopsy done a few weeks previously. There's a shaved area and a scar where the biopsy is taken, and we evaluate that in our frozen sections with special stains to see if they have abnormal glycogen. That's the muscle we like to use for diagnosing PSSM. But one of the muscles we're interested in looking at in Shivers horses and are potentially seeing some abnormalities in with just Shivers per se is the muscle that's just above the tail called the sacrocaudalis muscle, and it's labeled SC. So that's an area of continuing research. We're wanting to look more at that muscle in Shivers horses and see if it might give us some specific findings that we can identify in the muscle biopsy that would be suggestive of Shivers rather than polysaccharide storage myopathy. At one point, it was suggested that the cause for Shivers is PSSM, or EPSM, as it's sometimes referred to. And we did a study with Dr. Anna Furshman to evaluate this. And we looked at 113 Belgian draft horses, took muscle biopsies from all of those horses, evaluated them all for signs of Shivers. And we found that many Belgians have PSSM. In fact, 36% of the 113 horses we evaluated had PSSM. And we also found a very high incidence of Shivers in this breed of 18%. But we didn't find that every horse with Shivers had PSSM. And in fact, it worked out that a third of all of the horses with PSSM, had PSSM, and a third of all of the Shivers horses had PSSM. So what we believe is that there's just a coincidental occurrence of PSSM and high prevalence in Belgians, and a coincidental occurrence of Shivers in Belgians, and therefore sometimes inevitably you see the two conditions together, but they don't cause each other. Shivers and PSSM. PSSM is not a cause for Shivers and vice versa. So there's just a coincidental overlap. And we think that overlap can occur in warm blood horses too. And if they do have both syndromes, it seems like their signs of Shivers are potentially more severe, but also it seems like we can remove some of those signs and make them feel better if we put them on the dietary therapy for PSSM, if that disorder is also present in conjunction with Shivers. Well, what else could it be? We've talked about it. Potentially, could it be trauma? It could be vitamin E deficiency. It potentially could be overlapping with PSSM. One of the most difficult things to try to rule out is string halt, because that's also a movement disorder in horses that can cause them to have this exaggerated flexion of their stifles and their hocks with exercise. One of the things you notice with string halt, though, is that usually the motion is forward, sometimes so bad that they'll often hit the fetlock joint up on the abdomen of the horse, and that this doesn't have any hesitation, and as they walk forward, they'll flex and they'll put the leg down very quickly, whereas Shivers is usually worse when backing up, not a problem when they're moving forward, and you'll have that evidence of hesitation before the limb is put down. So in this video, I put a bell boot on the affected foot to make it stand out and make it a little bit more exaggerated, but you'll see with every forward motion, that this horse almost hits the abdomen with the flexion, that the leg is moved forward and down, and it's a consistent finding with forward motion. Many times with string halt, the disease will actually get better when horses trot, but be present at a walk, and can also be present when the horses back up. That specific type of gait also can characterize horses that are intermittently locking their patellas. So if they're fixing or locking their stifles, they can have it lock, the leg will get out a little bit behind them, and then as it releases, they'll suddenly flex their limb forward as the stifle releases. Another gait abnormality that you can see in horses, it's usually just affecting one limb rather than the other, is called a fibrotic myopathy. And in that case, they're usually damaged their hind quarter hamstring muscles, sometimes when they're turning sharply or sliding, or if they're out in the mud. And in that case, it affects the forward length of the stride, so that it shortens the swing phase as the leg comes forward. And then it often kind of gets pulled back suddenly before the leg slaps down and hits the ground. You can see evidence of fibrotic myopathy in this video, which is present in the left hind limb of the horse. And there isn't an exaggerated flexion as much, but the leg hits the ground quite sharply. And it's a shorter swing phase. Then the limb is placed very sharply on the ground without much hesitation, and a sliding back motion if you were seeing it from the side. So there are a number of other movement disorders in horses that can resemble shivers, and it really requires an experienced veterinarian to do an evaluation and determine, based on how the animal moves, all of the other findings, ruling out lameness, looking at vitamin E concentrations and other neurologic disorders, and then coming up with a diagnosis of shivers based on looking at the signs that we're seeing and ruling out other diseases. Most problematic question right now, in addition to the fact that we can't predict how this is going to progress, is what causes shivers? And we simply don't know what causes shivers at this point in time. In the studies that have been done on a small number of animals, where complete postmortem evaluation has been done, and the standard evaluation techniques are used to look at the muscles and the nerves and the spinal cord and the brains of these horses, there haven't been any microscopic abnormalities that have been identified so that we can say this is exactly where in the body shivers is causing a problem, and this is exactly the type of problem that we see with, be it inflammation or nerve damage or muscle damage. So it's a functional disorder of the nervous system to date, and it appears to involve the coordination of the nerves and the muscular system. And I can sort of best illustrate this with the following picture, which shows obviously a human leg, but it shows kind of all of the components that may be involved with the Shivers syndrome. In this case, it's showing you what happens when you take a reflex hammer and tap the tendon of the quadriceps muscle. And what that does is it activates spindles in the muscle that act as stretch receptors. And these spindles also sense gravity, and they are working to prevent muscles from being overstretched, and also to work against the effects of gravity to keep the proper amount of tone in the muscle. So if the muscle feels like it's getting overstretched and the spindle is stimulated, then the spindle sends sensory signals back up the blue pathway into the spinal cord. It then crosstalks between the flexors and the extensors of the limb and asks for a specific movement, so that when the extensor muscles are flexed, you'll have a reciprocal relaxation of the flexor muscles, and that allows the limb to move properly. So there's very complex regulation between some muscle groups and other muscle groups, and also between individual muscle fibers within muscles, to give you a very fluid motion and to allow a limb to contract and relax at exactly the right degree of consistency. And what we think is happening in Shivers horses is this coordination of flexion and relaxation is disturbed, and that's what's giving you these paroxysmal muscle spasms. And there are also connections between the brain and the regulation of these muscle components. And we think that's why stress can affect them, that there's a subconscious reflex action that's occurring that's resulting in these intermittent bursts of muscle spasms in the hind limb, and not the reflex relaxation that we should see when extensors are contracting and flexors are relaxing, and vice versa. And there are similar types of disorders like this in human medicine that are called dystonias, and there's a fair amount of research that's going on in humans, which we think may have some relevance to horses in terms of trying to define exactly what this movement disorder is. There have been some genetic abnormalities identified in humans that can cause dystonias, and we're very interested in knowing whether there's a genetic basis for shivers in horses as well. If you go back into the literature and look, interestingly enough, there has been a suspicion in the past that shivers is a neuromuscular disorder. And in fact, in the United Kingdom in the 1900s, the Horse Breeding Act was passed, which classified this as a genetic disorder, and it certainly seems to be more common in some breeds than in others. And so we are investigating this in cooperation with Dr. Baird in the Belgian breed to see if we can identify a genetic basis for the disease. There may well be triggering factors. We've noticed in some of the surveys that a fall or some kind of trauma to the limb has preceded the development of shivers in some horses. There may be an autoimmune component in which a previous infection may trigger antibodies to be formed against some components of the nervous system. That's an area that requires more investigation. To date, no cure has been found for shivers. We have tried with the horses that have come to the University of Minnesota many different things, including electroacupuncture, as you can see in the picture here, chiropractic adjustments, electrical stimulation, supplements that may affect nerve conduction like magnesium, vitamin E, and there's nothing that we found that will completely remove the clinical signs or the symptoms of Shivers disease. There are suggestions that we've received from many of the owners of Shivers horses as to what does seem to minimize symptoms, not remove them, but prevent the progression from being as rapid as it might be. And that includes keeping the horse fit, having the horse turned out, not stall confined as much as possible. And if the horse has polysaccharide storage myopathy, in addition to Shivers, a lot of times placing them on a low starch, high fat diet can be helpful and will decrease the clinical signs of Shivers. We found, though, that if horses don't have evidence of PSSM in their muscle, then sometimes the diet has very little effect. Making sure that they have adequate vitamin E is important, because I think if they're low in vitamin E and have Shivers, it can exacerbate the problem. And then particularly for the farriers that are having difficulty trimming horses with Shivers, tranquilizing them using xylazine or ditomidine can be quite helpful in relieving some of the anxiety that they're going to experience in picking up the hind limb and enabling the farrier to be able to trim the feet. What is really needed to understand more of this about this disease and to be able to develop potential treatments is more information. And as I mentioned, we have 50 online surveys presently, and we're extremely grateful to everyone who's replied. We have been a little bit hampered in our research in that it's only me that's been trying to manage this project amongst many other things, and I'm just delighted now that we've been able to recruit a graduate student to work on this. Dr. Alexandra Draper has joined us in the last couple of weeks and taken this on as her master's project. So she will be able to stay in touch with our surveys and the videos. She'll be able to keep a handle on those and have a look at those for horses with Shivers. And if you would like to participate in our online survey, if you own a horse that has Shivers, you can see the websites. You can either get to it from the www.vicstation.com survey, or you can get through it. We have a Shivers homepage on our Neuromuscular Diagnostic Laboratory website, and you can connect to that in that fashion as well. That's a little bit about what the survey site looks like. It doesn't take very long to complete, and we love to get the videos of your horses. We learn so much from looking at those videos. We haven't got a lot to offer yet in terms of what can I do, what kind of treatments can I offer, but it certainly is very, very helpful for us to understand the spectrum of diseases with the information that you have sent. The other thing that's really needed for shivers is to do some standardized treatment trials. We have ideas about neuromuscular transmitters from human medicine that might be of value. They need to be evaluated in a standardized format so that we can know for sure whether we've had progression of signs or improvement of signs on various formats. And we have some new specialized pathological techniques to look at the nervous tissue of animals, and we'd like to be able to use those to examine this disease in greater detail in animals that have to be put to sleep anyway. What we're lacking is research funding. We've got this wonderful support now from the USDA to do the epidemiology of the study and to look at the online survey, but to do the treatment trials that we'd like to do and to be able to do the pathology work that we'd like to do, we're really in need of research funding. And with the little information that we have on shivers today, there is a sense that this maybe is not that common a condition, and there may be other diseases that have a higher priority with research funding agencies, as research money is pretty tight these days. So if anyone has any ideas about possible sources of research funding to be able to continue to do this work and to look at the things that might help these horses in terms of treatment, we would be interested in hearing from you. So to kind of sum up, shivers is a very perplexing problem in horses. It tends to be a problem of large breed horses like drafts and warm bloods, thoroughbreds. We do see it in lighter breeds of horses like quarter horses and paints, occasionally Appaloosas, hunters and jumpers as well. We don't know what causes shivers. In some horses, it may be complicated by the presence of EPSM or PSSM, but it's not the cause of shivers itself. And it may have a genetic basis, or there may be other traumatic or toxic or autoimmune factors that are involved in the development of the condition, and that's an area that just needs more research to be able to document. There isn't a medication that we can give at the present time that will cure this disorder, but keeping horses fit and keeping them active and keeping them outside, keeping them on a balanced diet that's not too high in starch and that's got vitamins and minerals supplementing the diet seems to be the best strategy that we have right now. About 50% of the horses, with the information we have to date, appear to develop a progression, and that can be very gradual in some cases, or it can progress fairly rapidly. We've seen that sometimes when horses have been imported from Europe and they've arrived and been in quarantine for a while, and then they show progressive clinical signs. And clearly, to know more about this disease, more research is needed, and more research funding is needed to try to provide some of the answers that many owners are seeking with this disorder. And with that, I'm going to stop, and I'm going to see if I can address some of your questions. So one of the first questions is that owner has a 5-year-old Friesian mare that stumbles with her right rear hoof. And of course, when the veterinarian evaluates the horse, she doesn't do that. That's a pretty frequent problem that we often encounter. And so the question is, based on this presentation, is that shivers? And certainly that wouldn't at this point in time to be enough to consider that shivers. What we would like to see is not necessarily stumbling, because that's often evidence that the animal is not properly coordinating, and that's not a sign of shivers. What we would want to do, again, would be to back the animal up to watch whether or not we see those classic signs as the animal's backing or turning sharply, see if you've got any evidence of elevation of the tail, excessive flexion of the limb before it's placed. Those would all be things that we would want to see, not just stumbling to make a diagnosis of shivers. One of the other questions is, does shivers appear to be painful to the horse? I don't think that it is painful in the same way that we might find arthritis to be painful, but I do think that they develop a sense of anxiety if they know that that cramp is coming on, and when they develop it and it's prolonged, I do think there is a sense of discomfort. And I say that because that's what's also reported in people that have dystonia, is that there is an almost prodromal sense they get before they get one of these terrible cramps that just won't let go, and then they're completely out of control and can't relax. And so there's a sense of discomfort when it gets to be fairly severe and they can't get the muscles to relax properly. Another question is, do we know if this is inherited from the mother or father? And we don't know that. That's one of the things that we're really interested in trying to pursue and hoping to use the gene chips that have been developed for horses and see, by looking at this within the Belgian breed where we have samples collected already, whether or not we can identify a specific gene that might be involved or specific genes together that might combine to cause shivers. So we don't have any direct information on whether this is inherited as a dominant trait or a recessive trait. That we just don't know at the present time. Next question, sorry, it just jumped up a little bit, is one of the questions is, do pharmaceuticals like methocarbamol, which is a muscle relaxant, work in horses with shivers? And we don't know the answer to that. One of the grants that I submitted this year was to be able to maintain a herd of horses, 5 or 6 horses that have shivers, so that we could specifically try treatments like that and to see whether or not we could determine in a scientific fashion whether or not there are specific medications that are effective, and we haven't been able to do that and obtain that funding. So I don't know whether methocarbamol would be effective or not. And the next question is that shivers was more familiar to vets 100 years ago. Were there management or treatment strategies recommended in the old textbooks that would be worth exploring today? Well, I think that people were not quite as attached to their horses 100 years ago as we are now. So a lot of times what they recommend is that you don't breed horses that have shivers and that you don't use horses once they've developed progressive signs of shivers, but that you also keep them out moving around as much as possible and in work until they be rendered, as they said in the textbooks, useless from this condition. So I think we have better pharmaceuticals available to us today than anything that they had previously. And as mentioned, we do have some ideas on what we would like to look at in terms of working on specific neurotransmitters and seeing whether they have an effect. We just need to be able to obtain funding to be able to do that type of trial. Another question was, have I seen this in miniature horses? And no, I have not seen this in miniature horses. It's not reported in the literature in ponies either. And my sense, and we're going to get more information from this as people contribute to our surveys, my sense is that this tends to be more of a problem in very tall horses. When we look at the thoroughbreds that are affected, for example, a lot of those tend to be horses that are 16.2 to 17 hands tall. But we haven't confirmed that as of yet, because certainly we do see the disorder in quarter horses that are 15.2, 15.3 hands. So another question is, at what point do we recommend muscle biopsy? And I think the answer to that question is that unless you have a suspicion that the horse has polysaccharide storage myopathy, that at this point in time we don't necessarily recommend doing a muscle biopsy unless the horse is particularly problematic. And in that case, one of the things we're interested in looking at is the biopsy of that muscle above the tail, which we'd be happy to chat with veterinarians about how to obtain it. And so if the case is that a horse lifts only one rear limb when standing, doesn't have trouble backing, and no tail lifting, then I don't think at that point in time I would necessarily try doing the muscle biopsy. I might try the diet changes where you add a fat supplement and make sure the starch content is low. And I certainly would ensure that the horse is getting at least 1,000 up to 4,000 units of vitamin E a day and see if that has some benefit. With minis, someone's saying they've got a mini that's flexing her legs out behind her and became stuck. That might be a cramp. It also might be that the patella is getting locked. We do tend to see that much more in miniature horses, that their stifles don't have quite the same shape as an adult and they can lock their patellas. So rather than shivers, I would first look at whether or not you're luxating or locking the patellas in miniature horses. Another question is, could there be connection with EPM? Certainly, a full neurologic exam is an important thing to do on these horses, and if there's any evidence of incoordination in the animal or localizing signs, testing for EPM might be worthwhile, but there are many horses that have shivers that do not have EPM, so I don't think there's a direct connection between shivers and EPM itself. And another question is, what type of fat supplement is recommended? I mean, there are a wide variety of fat supplements that are available. There isn't necessarily one that's better than the other. We usually recommend for horses with polysaccharide storage myopathy that they're getting 15% of their calories as fat a day, and that's usually long chain fats. So, and based on omega-3 and omega-6 ratios, some of the better fats with that ratio tend to be fats like soy oil over corn oil or canola oil. For example, you can add flaxseed oil to diets as well, although and that often you can't get. It's very I think you should add some of that at the recommended levels, but you may need to add soy or canola oil in order to get up to the level of fat that a horse with polysaccharide storage myopathy needs. It's also important, if you're adding fat, you don't want your horse to be excessively overweight, so you need to balance the caloric needs first before you start adding fat to a horse that's already overweight. Another question is, do we see more abscesses in horses that have shivers? And not to my aware of have we seen more foot abscesses in general in horses that have shivers. And the vitamin E dose, if a horse is kind of sedentary and not doing a lot of activity, we recommend 1,000 units a day. But if a horse is in high athletic activity, we usually recommend at least at about 4,000 units of vitamin E per adult horse per day. So again, thank you for those questions, and I would encourage you to look at our website. And we, with Dr. Draper now, we will be able to follow up more clearly than we have in the past with this information, and really look forward to seeing your information and working in the future to see what we can do to try to help horses with this poor condition.
Thank you so much, Dr. Valberg, for your presentation this afternoon. And I want to say thank you to all of you for participating, and to let you know that later this week, you will receive an invitation to participate in an online survey about today's webcast. So if you could take a few minutes to give us your feedback, we would really appreciate it. And also, as I mentioned, this webcast is in a series on equine genetics, and there will be more webcasts in the series. So just check back on our website, myhorseuniversity.com, for updates. And also want to let you know that our My Horse University and Horse Quest free monthly webcast will return in September. More information will be available on our website soon, and you can also become our fan on Facebook or follow us on Twitter for the most up-to-date information about upcoming events, special promotions, and more. And remember that this webcast was recorded and will be uploaded to our website by the end of the week. You can send us your comments and suggestions to info@myhorseuniversity.com. And thanks again, and have a great afternoon.